But the only thing about this, if you guys aren't used to using and finding the psoas, you might not be able to feel it as well if you only have your fingertips. So you guys do the best you can finding it. I'll help you, and I'll help you find it if you guys have problems finding it. All right. Another way to find it is that once it's on there, he's in this position, I will press into where I feel it is, and he will flex again his knee, and it'll jump right underneath the fingertips. So once you have it, do that once again, Will. Jump in my fingertips, so I know exactly where I'm at. All right. The psoas and the what is going to be pretty much 80% of lower back pain in society.
The QL.
The QL. Because again, they work together, right? They work together in the core. In the core, where sitting positions, but also sleeping in a fetal position, driving. Okay, all the things that we have our body in this position. All right. If you have athletes who specifically cyclists, right? You get a lot of psoas issue because you're always in that crunch. Right, and then also you're always pedaling, right? So it does, yeah. But it's good that you do it a bunch of times because if you continually release your psoas, it helps. Okay, so again, 85% lower back pain, guys. If you know how to work the psoas effectively with the QL, it'll relieve a lot of issues for your clients. Okay.
Can you show us on the other side as well?
On this side?
Yes, please.
Yeah. So get straight this side. So if I use the towel, I'll find the iliac crest. I'll do with that towel first, show you. Here.
I mean, before the bone up, right?
Yeah, can you show me the SISs on the Mr. Boney guy behind you? Turn him around. Show him around that. Nope, a little higher. Right there.
It sticks out. It's anterior.
The puppy thing.
Hippo. There it is. Right. Yeah, if you find it on you'll feel it because it will definitely be a prominent bony structure. Let's go maybe about 2 inches up, depending on the size of the torso and the person, right? And diagonal in.
Okay.
Okay, and then he'll
sinking down into it.
sinking right into it, and then he'll lift his leg up a little bit, and you'll feel that muscle pop underneath. So if you're deep enough. All right. Some people, if you just keep their leg in this position, sometimes they'll be that way too. And depending on again how tight his psoas is, or okay. So once we get to that area, can I go back over here now?
Yeah. Yes. The instructor said you can go back over.
You guys are filming everything. I want to be in the right position to film.
You get your hair.
All right, Will's here. Will's here. All right. So once you find it, loosen it up with manual. All right. And manual therapy is like what we just did, either deep cross fiber massage on the obliques and rectus femoris, or deep pressing in and then doing strumming motions. to loosen
Doing
up
what
the area.
motions?
Strumming.
Strumming?
Like strumming the guitar. Yes. Once you find it, or once you're close to it, again, the cup is going to do a lot of finding for you. Once you get out there and lift. Because then you can place that one there, and then you can coordinate a section with the TFL and then lift it. The psoas, let me see real quick here. Here it is. The psoas attaches here, right? There it is right here. But if it goes through the pelvis, then where does he attach to? Or, to the almost head of the femur. So you can take that, and again, getting it close to where you think that femur is, you can get it close to there. Okay. So he can do knee flexions and hip flexions as you're lifting this. You guys will feel this one if it's tighter. All right. Good. So as lift, you can also, from here, you can go a little bit more anterior, do the same thing. All right. Especially if you're dealing with a lot of muscle tissue in the abdomen, whether it's rectus femoris, transverse, or obliques. Okay. Get a lift in there. Okay. In a second, I'll show you a sideline where we can get psoas and Q all at the same time. But let's say keep them face up first. Okay. Let's see. What's the directions for clockwise? Digestion.
Yeah.
Those guys what are you doing right now?
Oh yeah.
Oh yeah. So going clockwise and warming up the abdomen this direction. Because now we're going to do a diaphragm decompression.
Yeah.
So to find the diaphragm, we look for the bottom of the rib cage.
Bottom of the rib cage.
Right here.
So
Whoa.
sensitive.
Right here. Looking for this.
Is it? We're going really gentle.
Right? Diaphragm is underneath here. All right, so it's going to be right along the edge of the rib cage here. Does that show it? Kind of, sort of. Right there. Diaphragm goes underneath the rib cage. So it's a breathing muscle. So it actually helps, fill in and create space for the lungs to expand, right? So if this muscle is tight, how does someone get a tight diaphragm? Asthma. What else?
COPD.
Yeah. I mean all the external. But how does an athlete get a tight, intense
breathing.
intense breathing, but short and short?
I would say people that have anxiety and panic attacks.
So anybody that, well, not everybody, I mean athletes who do a lot of quick active breathing, right? Which a lot of athletes do. So usually what happens then is that the muscles in the psoas get pretty tight.
Yeah.
And not knowing that. So you can release it by finding the rib cage, getting right underneath it. Right underneath it. He put his arms above his head, stretch his torso. We'll take deep breaths as I'm pulling downwards. So inhale again.
Spicy.
And as he's inhaling and as he exhales, I'm going to again pull diagonally down towards me. If you do that again and lift up, we also do opposition. Some of you guys will feel this really weird. All right. You're like, right.
And that's to loosen up the rectus abdominis?
And the diaphragm specifically, yeah. So yes, thank you so much, Robert, because you can definitely work the rectus abdominis by just bringing it closer together. And again, taking deep breaths. Trying pulling it all the way down. What's also weird is you go right over the umbilicus, so sometimes you might not want to do that.
Okay.
You're like, okay, I'm not going to do that. Again, rectus abdominis goes all the way to the pubic bone. Okay? So you can take these cups all the way down there. So when you guys get to the diaphragm, it can definitely be a lot of good movement for you guys. Diaphragmatic releases through massage is what you get underneath here. You guys ever done that yet in your classes? Right? Again, getting underneath the rib cage, doing strumming motions, controls like this. Gotta be careful because the liver is up here. But you can get a diaphragmatic release as you get underneath the rib cage here. But this may be too intense for someone. That's where the cups are really, really good to work with as far as cupping tools. Okay. If you cup the abdomen, guys, because again, you can get to the rib cage, and it's nice that we have this because if it is a female, got to keep this covered. You can get all the way to the rib cage up here, And again, it's a breathing muscle, right? All the intercostals and the serratus muscles. So I would put this on here, right? And I will slowly either go down, starting from the top of the ribcage, slowly down. At the same time, you just have them, just remind them to just continue to breathe. Same thing, all the way down, all the way down. For those of you who's ever run and get like a stitch in your side, like a side ache.
yeah.
Okay, so what's that? Well, what's that muscle being cramped? What's the muscle? Oh, it's diaphragm, but also serratus. Intercostal serratus, yeah. But sometimes those muscles too can get pretty interesting too. So again, get as high as you can up. Again, if this is a female, I would do this for breast modesty, but I can still get to here. If you guys can see. Okay. And he can take his arm over his head and stretch even there. If I have a couple cups on that ribcage area. From there, I can even just stay here and do my lifts and stretches back and forth like this. Okay. Back
Using my imagination.
All right. Okay. So, what else do we have? The pecs. So the pecs we can hit a couple ways, right? For females, obviously you're going to cover it, keep the breast tissue covered, or you can do this. Let me teach you here. This. You guys ever do this one?
Wow. Hold on.
Hold the top.
Yes.
Okay, so then you can get the sternal attachments for the pecs. Just right there. That's how you can go for females.
Oh, go ahead.
And with that, get the cups along. And man, we forgot to shave this morning. So get a right on the sternum, because again we can cup on top of the bones, right? If we get on top of the sternum, we can definitely affect all the surrounding tissue that's adjacent to the sternum for breast tissue and pecs. Right. For the guys, obviously, come on. For the guys, obviously, you can go ahead and do whole upper pec via here. Just trying to get the areola. It still doesn't feel good, even if it's a guy. Or if it's a female, you can have them hold the tissue of the breast to make it taut. In other words, pulling away from the structure, and then you can stay here. Instead of you doing this, have them do it, and then you could do either lift and stretches, glides sternum to axillary, okay, from here to here.
Okay.
And then arm is out here. With the other hand, hold the breast tissue, make it taut, and even added support, I'll place my hand on top of theirs. And you can hold, and then you could do either drags or straight lifts. Oops, sorry. Straight lifts. There's nothing. Straight lifts. Or very gently and easily work your way towards
That's so good.
all the way, because what pecs attached to where? Right there. The humerus. Pecs will be there. If you have a male client and they're okay with multiple cups, you can. Even here, here. Where's my other?
There's one in the middle of his chest.
No, this one. Oh, is it?
If you have a female client and she's fine with being undraped, would you still recommend that she holds her breast tissue so that you can still get in those photos?
It's the matter of also having the skin taut, Ruby. So when you were pulling or using the pull on Susan's
For the
leg,
stretch?
yeah, remember he held you held the skin taut. It was
Yeah.
easier to move. Same thing here, Ruby. Okay. From then he could do his what? He could do his hopefully flexions and stretches. All right. You can go above the head. You can come down below. Again, depending on where the cups are, guys. Just get a full stretch in that area. Okay. And sometimes even because you can actually do like even some rotations for that anterior deltoid. Do that too. All right. The area of the anterior delt can also be affected too, right? But what are some of the nervous structures we have here? So we have the bicipital nerve, which kind of correlates with the bicipital tendon. So you want to get the tendon, but not too much on the nerve. So once you do a good manual warming up of the area, and you could get that and get it on there. Maybe just start doing a couple suction and releases first, just to warm up the area. Then you can leave it on just statically. Right. You could do a flex, extend his internal glide that way. You can place one on the anterior delt. You could do his front raises. And you can definitely do a full cluster if you wanted to. With medial, anterior, a little bit of the top there, and then just get a little bit of trap, and you could do is just range of motions in all directions for the shoulder. Okay. Things we did, I think we did with you guys the first night when we were sitting. So just doing that lying down. All right. Go ahead and lie facing that way. Yes. Okay. So the last position I want you guys to practice today is the sideline position. And now we have options to do everything that you have done from yesterday, body parts, the whole legs, and back, and then shoulder. So, okay. Right? You can do what? You can do is this flexions and extensions. Right? You could do knee to chest. Right? You can do his flexions this way. Do all his flexions this way. One. Everything here. But now there's an option now of doing inner thigh this way. So when bend your leg, have this exposed.
Oh.
So if you want to do inner thigh now you can get to this position. And this actually to some people may be even more comfortable because then it's relaxed. Okay, you don't have to put it in a good girl, bad girl position. Just have it straight up like this. You go straight down for compression and warming up. And then just take it to wherever you feel you want to hit the sides. Okay. You could do lifting and stretching, or lifting this leg up and down. That's internal glide for the adductors. Okay. You can even do flexion, extension of this leg. Sorry. Yep. Sideline. Cool. But the fun sideline part is when, remember we talked about the low back? What are the two muscles we need to work with? QL and psoas. And now we can get this really, really good in the sideline position. So, who's it, David? So that you want to how you get the psoas from if there's a lot of adipose or a bigger, larger person. Have them lay on their side because gravity is going to pull everything down towards the table. It's going to expose it here, right? So I can get to his. There's this hip bone right there. I can get to the psoas here. Or I can go to the front of the table, find his iliac crest again, and with 2 thumbs, get it this way. So it all depends on which direction you want to
What
get it.
position would he move his leg to check?
To check, he would again do a flexion.
Okay.
Same flexion, yeah. The movement is the same. I mean, it's always going to be the same. It's just all positioning where you find. Okay. So once you have it, or you know where it is, then you could place your cups at the same simultaneous area. Probably since he's got a thick torso, I'd probably get more cups. This guy. I go to all those areas at the same time and do pulls, stretches, bit psoas, and QL at the same time. Side stretch for the psoas on the table is he's going to scooch towards this end of the table for me. You're going to keep your legs supported here. He's going to take this leg off the table. He's going to drop it. So then you could do a not psoas, but a QL and hip stretch this way. With the cups there, he can let the leg drop, and I'll lift. And I can use this arm, push down. So this is a pretty intense stretch.
That'd be awesome.
Yeah. Yeah.
Yeah.
Again, to get that pushing down, you'll feel it here. Are you okay, Bo? Yeah, he's chilling.
He's digesting.
He's hanging out. Feel the burrito right there, though.
That's where it went.
That's where it went, exactly. It's working its way around.
Where that was.
Sorry, getting hungry again.
It's working its way around.
I know the pain, bro. I know the pain.
Okay, back on the table. Skateboard to your center. Thank you. If you wanted to, you can get you can get more pec stuff here. Right, and then just having yourself do more stretch this way. Right. And then last but not least, you can cup this whole side of the back. Right, like what we did in first class. In the first class, you can get to the erector spinae and the lats if you wanted to in this position. Thus getting more side stretches. Sorry. Okay, so then you can get some side stretches and movements here. Exactly. So now you guys can see exactly where all the opportunities you have here for sideline.
Yeah.
Right?
Right.
Okay, so okay. Anything you want to do for low back, anything you want to do for the shoulder, top leg, bottom leg, psoas, sidelining is your friend if you want to get multiple areas of cups at the same time. I'll run back. All right.
Okay.
Any questions?
For the forearms and hands, are we doing that?
Forearms and hands, we did a little bit of that.